Peripheral Arterial Disease, or PAD as we like to call it. It's a very common condition. It has a lot of risk factors that will sound familiar to you. Things like diabetes, tobacco use, age is even in there. A number of different things, but we all have family members or friends who are affected at one point in time by some of those risk factors, and many of our friends end up getting peripheral arterial disease. What it is a narrowing of the arteries. Now it happens in several different areas of the body, but we're talking about the legs specifically. Now when you have that narrowing, it's kind of like hard water building up on the inside of a pipe in your house. Or I don't know if you've ever changed the hose on a washing machine in the home. You see this white buildup so that when you turn the water on, instead of gushing out, it just drips. When that happens in the body and the feet, there are pretty grave consequences. The muscles don't get the blood that they need to use fuel and to get oxygen and continue to function, so they may cramp. They may get weak and they may atrophy, which means get small. In some cases, if you get a cut on your foot, that cut may not heal, or you may develop an ulceration. And that's a pretty big deal. That can lead to infection. If the infection gets into the bone, it's very bad. These are the patients that you see with amputations, non-traumatic amputations. So when we see patients who have these risk factors, we look on exam, we evaluate them, and we use tools like ultrasound to determine if they have the disease. When we identify that disease, we're able to go in through a very minimally invasive procedure. There are no incisions with this. It's much like an IV, so just a little puncture. And through that puncture, we're able to open up those arteries that are blocked. We can shave plaque out, we can dilate with balloons. In some cases and in some parts of the body, we may use a metallic stent to hold that artery open. But these are very effective treatments, and in almost all these cases, we're very effective at preserving the tissue. And what I mean by that is preventing an amputation, and that's our goal. We want to keep these people active. We want to keep them walking. Those are two of the most important things for leading a good quality of life, but also having some longevity, the ability to enjoy more time with your family.